Tonight on Island Sun.
Get the hell out of here!
Greg?
How long's he been like this?
I don't know, possibly hours.
He could have some brain damage.
Is it always gonna be this different?
You're always going to have to worry about certain things that other people just take for granted.
What's with you, man? I mean, you're treating Greg really weird.
Are you listening to me?
Dad, what do you want from me?
Just be a friend.
I wasn't ready.
That's game.
Daniel, I wasn't ready.
Yeah, you always say that when I ace you.
You only ace me when I'm not ready.
Kenji, you're a sport. What's wrong?
Oh, it's just a little bug bite. It's nothing.
Looks like something to me. He looks infected.
Daniel, I'm a busy man. I don't have time for an infection.
Maybe we ought to quit and get a culture of that. I'm doing a short shift in the ER anyway.
I'm fine. You're just saying that because you're losing.
I'm ahead.
Ah, but you sense the momentum shifting. Go, buddy.
Great time. In spite of that stupid helmet you're wearing. Hey, this stupid helmet is an aerodynamic wonder. See, when you ride, the wind flows over the top, creating a vacuum condition. And that, in turn, provides you with a greater lift. And then that stabilizes...
Whoa, I'm sorry I brought it up.
Hey, I'm just trying to add to your data stored in your so-called brain. It's called knowledge.
That's boarding school knowledge. I prefer real-life experience to useless trivia. That's the fourth one of those today. You must be part sponge.
I'm thirsty. Ergo, I drink. Seems logical to me.
Think you can speak like a normal person for once?
Hey, I would have thought that you would have learned to appreciate the intricacies of the language from your father. After all, he is a doctor.
Well, he speaks English. Not bad. Gotta do better.
Gee, talk about a slave driver. I think we're training for the Tour de France instead of a hospital charity fundraiser.
We gotta be in peak condition. We got a month to get there, okay?
A month more of this, I'll be dead.
Good news, guys. Guess what arrived last night?
The new wheels?
You got it. Awesome.
And waiting for us at my house, you guys, so don't lag behind.
Talk about a slave though.
Hi, Alice, what have we got?
Japanese male, 46, right upper quadrant abdominal pain, onset this AM. His temperature is 101, otherwise vital signs are stable.
Dr. Dotson, OR stat. Dr. Dotson.
Mr. Sakai, I'm Dr. Kalani.
Hey, Doc.
I hear you've got some abdominal pain.
You said it, Doc, and it's a real drag.
Can you describe the pain to me? Sharp, dull?
It just hurts.
Okay, lie down, please.
We need a CAT scan.
Okay.
Oh, yeah, right there, Doc.
Anyone in your family have a history of gallstones?
All over the place. My mom, a couple of aunts.
Well, I'm going to order some tests, but I think you've got a gallstone in there blocking things up and causing an infection.
You sure it's not a bowling ball?
Pretty sure. I'll be right back.
Take your time. I'm not going anywhere.
Alice, I want a full blood panel and ultrasound. You'll probably have to be scheduled for surgery. Okay.
Yes, Dr. Kalani.
Kenji, how's that leg?
Oh, it's fine.
That's why you're limping?
I'm not limping.
Let's take a look.
Daniel, I'm perfectly capable of handling a minor wound infection, thank you very much. Besides, I put myself on antibiotics merely as a precaution, okay?
I make it a rule never to treat myself. You can get in real trouble that way.
Well, to each his own, okay, pal?
Scottsy's the ultimate bike.
An awesome piece of engineering.
No, Scotsies are definitely overrated. Angelos are the best. It depends on what you do with them. Lighter materials. Yeah, like titanium. It's awesome.
Okay, hell in my eye, time for food.
In a minute, Nana.
I'll have some.
Good for you. You need to eat. You too skinny.
This guy eats all the time, Nana. He eats like a vulture.
I don't know what it is. I just can't seem to keep the weight on. I think it's my metabolism.
Hi, everybody. Hey, Greg. Heard from your parents lately?
Yeah, I got a letter from him yesterday. He told me to tell you hi. They sent me this really cool African sculpture from the villagers staying in. Rough life.
Awful.
This is great. I'm starving.
Hey, how's this look?
No, it's out of true. You gotta tighten the spokes.
Yeah, now whatever happened to the simple 3-speed bike?
Get with the program, Daniel.
Morning, Kenji.
Hi, Dan.
Any particular reason you're just sitting there?
Oh, I don't feel like getting out right now.
It's your leg, isn't it? Let me see. Kenji. I'm admitting you to the hospital now.
I'll see you later.
You bet.
Well, we think that Chamber of Commerce of Hawaii is receptive to any
Mr. Sky,
Hi, Doc.
you moving in?
All the comforts of home.
What's Mr. Sakai doing here still? I thought he was admitted yesterday.
Well, I know, but it turns out there was a snafu when he checked in. His health insurance is with an HMO, and they won't approve his admission here.
So what's the problem? Have him transferred to a hospital where he is covered.
Yeah, well, we would, but they want us to pay for the ambulance. They say that's our responsibility.
Then why don't we pay for it?
Well, it's in the works. We're waiting on approval from the financial boys.
He has a liver abscess that needs to be surgically drained. He should be in a hospital.
Tell me about it. We're marking time here, controlling the abscess with antibiotics. Daniel, pretty soon we'll get the word, and he's out of here.
I hope so.
Alice, we need a new lab value for Mr. Sakai.
Yes, Dr. Rowland.
Dr. Harris.
Do I have a choice here, Dr. Kulani? No. Don't worry, it shouldn't be too tough. Extensive cellulitis, possible early sepsis.
What if I make a mistake? Think how it'll look on my record. Resident kills chief of surgery.
Tony is just another patient, okay?
You say so.
Caldwell, you're losing it, man. Too much pasta.
What's wrong with me today? Told me that I would have beat you up that hill.
In your dreams, buddy. You all right? Looking kind of pale.
No, I'm all right. Just a little tired, that's all.
Well, so how's it come with the bimbo cheerleader you got your eye on?
I haven't got my eye on her.
Well, every time she comes within half a mile of you, you start panting.
I mean, we're just friends. And she's not a bimbo. She's a total fox. Race to the bottom of the hill.
Hey, that's cheating.
Dr. Feldman, in your new book, you state that men with cholesterol readings above 264.
Well. I see they got you all hooked up.
What's he doing here?
He's your doctor. Excuse me.
Yes, once again, good triumphs over evil. You all right? What's wrong? You all right? You okay? Greg, you all right? What's wrong?
Hi, Greg.
Minutes ahead of the lead pack. No one expected to see this today.
Pretty good. So what's the verdict?
Well, the blood test confirmed my initial diagnosis, Greg. You have diabetes.
Too many chocolate chip cookies, huh?
It's not quite that simple.
Yeah, I know. So how long do I have to stay in this place?
Not long, a couple of days. It's mostly a precaution. It makes it easier to stabilize your treatment.
This is not exactly my idea of fun.
Well, after a while, you'll forget it's there. We need to replace some fluids. You were dehydrated.
Poured low, huh?
Well, 3 liters, but who's counting? Listen, I got a message out to your parents. It'll be a few days before they get back to base camp, but they sent a group out to look for them.
Thanks. So am I gonna die or what?
No, of course not. You're gonna be fine. Diabetes can't be cured, but it can be controlled.
With insulin.
Right. Your pancreas has stopped making it. And without insulin, you can't utilize your blood sugar. You essentially starve to death.
Well, that's one way to go on a diet.
Greg, believe me, we're gonna get you through this. You are gonna be okay.
Can I hold you to that?
Sure.
Gonna be okay?
Well, he will be, Bono. He has diabetes.
And how'd he get that?
Well, nobody knows the cause. Somehow, some people just stop making insulin. I mean, it's treatable. He'll be okay.
He seemed so normal a couple days ago.
Yeah, I know.
It was like he was gonna die or something.
No, he wasn't that bad. But he might have been if you hadn't been there and brought him into my office. You can see him if you want.
Nah, it's okay. Tomorrow's probably a better idea.
Okay.
I'm gonna split, go home.
The patient was in good health until he noticed an insect bite, which apparently became infected on the day of admission.
It was the day before admission, Dr. Metzger.
Sorry. The patient placed himself on erythromycin. Unfortunately, no culture was taken prior to his going on the antibiotic.
I didn't think it was indicated.
Which, of course, is not always indicated, making it impossible to identify the organism. We placed him on triple antibiotics and at strict bed rest.
Which I also do not think is indicated. Metzger, are you familiar with recent studies showing ambulation to be beneficial in cases of this type?
Yes, I am. However, I felt caution was indicated in this case. Anyway.
His examination, Dr. Metzger.
On presentation, the left lateral ankle showed an abscess with infiltration into the surrounding tissue measuring 3 centimeters in diameter.
It's 4 centimeters.
Sorry, Dr. Fushida, 4 centimeters.
It's okay, don't get up. Hey, guys. We'd have come sooner, but the guards wouldn't let us.
How you doing?
I'm pretty good. Oh, where's Sam? Oh, he had to do something for his Uncle James. You know, make a little money. Said he'd be by later, though.
So, looks like they really got you plugged in here, man.
Yeah, all wired up. Tubular. Hey, if you think that's bad, just taste the food they're giving me. A special diet, they said. The only thing special about it is it tastes like old socks. Okay, enough of this idle chatter. What'd you bring me? Come on. God, are you mercenary? Latest in bicycling magazines. We don't want that finely tuned brain of yours to lose its edge. Yeah.
Yeah, just because you're stuck in here, don't think you can start goofing off on your fellow teammates.
Hey, thanks.
Got it. Okay, guys, let me do this.
Got it, Doctor.
All right, it's moving.
Okay. Now get ready. All right, got the sheet on? Yeah. Okay.
Great place, huh?
3, 2.
You're all right, do you hear me? You're all right. Just don't panic and breathe deep.
Anyway, I guess we better be going.
Yeah, save those for us. They cost us a fortune.
He probably stole them.
Is that all, Doctor?
Yes, that's all. Thank you.
Bye. Hey, guys, take it easy.
Emma, I will not use it. End of discussion.
But Dr. Fushida, the orders say you have to use a bedpan. I can't change them.
Dr. Metzger. Tony, about the bedpan. I'd appreciate it if you changed the orders.
I'm sorry, Dr. Kulani wants you to have complete bed rest.
Look, Metzger, you read the articles I mentioned. That treatment isn't necessarily appropriate. So I don't think Dr. Kulani would mind if you made a change.
I'll check with him.
Better idea is to check and see if that light outside my door is working. And if it is, try checking with the nurses to see why they never seem to answer it.
Doctor, we can't be in here every other minute. We have other patients to look after.
Actually, that bedpan makes a lot of work for the nurses, doesn't it? I think it'd be all right for you to use the bathroom.
Thank you.
It'll save you having to call for the nurses quite so often, I think.
I think so, too.
Thank you, Dr. Metzger.
Nicely done.
I'll see you in half an hour for your bone scan.
Yeah. Bone scan. Metzger.
Yes?
Greg Caldwell, he's supposed to be on this floor.
Room 704, down that hall.
Thanks.
Here we go.
Coming!
Clear the way.
Go. Stay clear.
Coming through.
Oh, here. Oh, right there.
These strips will give you a reading of your serum glucose level. First, we need a drop of blood. Alcohol. And take this machine, place it on your finger, press this button. It doesn't hurt at all. Right? Okay. And put some blood on the end of this strip. And in 60 seconds, you compare it with this chart, and you've got your reading.
Miracles of modern medicine. Hello?
Greg, hi, it's Sam.
Hey, Kulani, what's happening?
Nothing much. How you doing? Everything okay?
Oh, pretty good, considering. Sometimes I feel like a human pincushion.
Well, listen, I'm really sorry, and I got a little bit of a problem stuck on this job, so I'm not gonna be able to stop by today. But I'm gonna come by tomorrow.
Well, good news. I might be coming home tomorrow.
Hey, it's great. That's great. They tired of you already?
Very funny.
Well, look, so I'll catch you later. I gotta go.
Hey.
Bye.
Time for your evening insulin.
Tell me, do they actually pay you to torture people?
Not enough, honey.
William, this is ridiculous. The patient's been parked in the ER for 3 days. 3 days. You're the hospital administrator. Do something.
I understand the patient's in no immediate danger, and there are important precedents to be considered here.
Precedents?
Yes, our lawyers have informed me that if we were to pay this man's ambulance, we would have established a precedence for future cases of this type, and it could cost us a lot of money.
Then admit him. You know, while you're making up your minds. It'll be a lot less expensive than keeping him in the ER, and he'll get better care.
We can't do that either. You see, we will be reimbursed for his stay in the ER, but we would not be reimbursed for any hospitalization.
So you're letting a patient's care suffer for some bureaucratic nonsense.
I'm working on finding an equitable solution.
Meanwhile, he's stuck in the ER.
Yes.
Why am I reminded of a merry-go-round here? Morning, Greg. You ready to go?
Whatever gave you that idea?
That's a wild guess. Do you have everything you need?
Yeah, diet sheets, insulin, glucose strips, diary, the works.
Okay, well, let's talk while we walk.
No offense, Doc, but I'm out of here.
Right, but you're gonna have to take it easy for a while. All right, then. Just remember, no bicycle riding or strenuous exercise for 2 weeks. Not until we're sure your blood sugars are stabilized.
Jack.
Yeah, I'm really impressed by how quickly you're picking all this up.
It's a piece of cake. Shot here, blood there, so on and so on.
Greg, listen. It's going to be a lot harder outside the hospital. Everything's less structured. We've got a lot of adjustments to make. It's not going to be easy, believe me.
All right, let's go. We've come to spring you before they change their mind.
Hey, Greg. You've got an appointment set up for every day next week. But if you've got any other problems, just give me a ring anytime, day or night.
Let's go. Get the lead out.
Where are we headed? To Kalani's house, where there's some wounded bikes needing your professional expertise.
So long.
Bye. I'm telling you, all you have to do is change the gear ratio slightly and you'll pick up more speed.
Yeah, at the expense of my legs. Make it too hard to pedal.
But you would go faster. Sam, did you tell this man it'd make him go faster?
Oh, yeah, sure.
Hey, while you're in there, can you grab me a cookie?
Yeah, me too.
Got one, Greg?
Fair button, I'm afraid.
Oh, yeah, that's right. I'm sorry. I forgot.
Don't worry, I'm not gonna croak just because you asked me. I'll be right back. What's with you, man?
What do you mean?
I mean, you're treating Greg really weird. How'd you like to be in his shoes?
Hey, check this out. What an awesome fight.
It's tough.
Greg?
Seen enough? Get the hell out of here!
Greg, I'm sorry.
You think?
I see what you mean. Right there.
Right. It only shows up on that one view. I'm still not sure it's an osteo.
Well, it's too close a call. We have to treat it as if the bone is infected.
Damn, I was afraid of that.
Hey, don't feel bad. It was a good pickup. Would have been easy to miss.
It's not that. Dr. Fushida's expecting to go home tomorrow. This will mean another week in the hospital, maybe 2. I can't take it.
Tony, I know Dr. Fushida can be difficult, but...
Difficult? He second guesses all of my orders. He doesn't obey half of them anyway.
You know, you can learn a lot having to deal with someone like that. It can help you develop understanding, patience.
Not so far. Dr. Kulani, please, take me off this case.
Well. Kenji.
Daniel.
How you doing?
Oh, as well as could be expected, considering the circumstances.
I wanted you to know that Dr. Metzger's workload has gotten a little heavy, so I'll be taking over your case.
Oh, that's too bad, Metzger. You were doing a fine job.
You're kidding.
Kenji, we took another look at your bone scan. We think you may have osteo.
Think? What do you mean, think?
Oh, there's a spot. We'll know for certain in a week or so.
Let me see. Where?
You can see it on this view.
I don't see a thing.
No, right here.
You're imagining things.
There's a spot.
What spot?
Kenji, use your eyes. There's a spot right there.
I can't see a bloody thing. There's no spot here, Daniel.
There are a couple of glucose values missing from yesterday.
I know, sorry.
Well, we really need to have those values. We need to know what your sugar's doing all day.
So you can regulate my insulin dosage, I know.
Right. This is important, Greg.
Everything is important.
Some of these levels yesterday are a little higher than I expected them to be. You have been taking your insulin, haven't you?
Yeah. I just cheated on my diet yesterday.
It's okay. You wouldn't be the first person to miss a dose.
I just passed by a donut place and I couldn't resist. I had a major pig out.
You know, you could get into serious trouble if you start missing injections.
Dr. Kulani, I'm sorry, but you wanted me to tell you right away if Mr. Sakai was still in the ER. He is.
Greg, I'm sorry. There's something I've got to do. I'll see you again tomorrow. Hang in there.
Yeah, I will.
Get me a chem panel before he leaves.
It'd be a lot easier if you just put in a faucet.
Daniel, I cannot allow you to do this.
Try and stop me. Mr. Sakai, I'm sorry. I thought you'd been transferred. I dropped by to see you last night, but you weren't here.
I ran out of stuff to read, so I took her to the hospital.
Oh, my God.
Well, you're being transferred now. Hop in. I hope you like convertibles, because that's what you're leaving in.
Sounds good to me, Doc. I can get some rays on the way.
You cannot drive this patient to the other hospital yourself. Daniel, we could be liable.
William, I don't care about your lawyers, or your lawyer's lawyers, or your finances. All I care about is him. In case you've forgotten, our purpose here is to take care of the patient, not move papers around. I'm only doing what should have been done days ago.
Bye, gorgeous. You got my number. Call me.
Kulani. How's it going?
Great.
I just thought I'd stop by, see if you want to go on a bike ride. The old corpuscle's working.
You sure you're supposed to do that?
Why not?
I don't know, I just thought,
that I was some mutant and I can't ride a bike anymore, yeah.
No, I mean, it's just, well, you know.
Yeah. So, what do you say? I mean, I got all the supplies in the pack. It's a beautiful day. Let us tarry no longer.
Greg, I'd like to. I can't. I got a prior commitment.
Right. Whatever.
No, Greg, really, I'm serious. I got a commitment here.
Oh, no, it's okay. Some of us are just lazy bums, that's all. Check you later.
Nurse Lahuda, third floor nursing station. Nurse Lahuda, third floor nursing station.
What are you so happy about?
I have been freed of the burden of taking care of Dr. Fushida. I feel as if a ball and chain had been cut from my leg. Life is wonderful again.
I can't believe you're still seeing patients.
The house staff is overworked. I can't have them covering for me any longer.
If you don't stay in bed, you're going to be here a month instead of a week.
Yeah.
And what's this? I don't recall ordering a sleeping med.
You realize how difficult it is to get a good night's rest here?
You've been writing orders for yourself on your own chart? Kenji, you are impossible.
And you have a lousy bedside manner, Daniel.
That's because you are a lousy patient.
Oh, really?
I'm a happy, happy man.
Dr. Brand, orthopedics. Dr. Brand, orthopedics.
I want to talk to you.
Give me 10 minutes.
No, it's important.
Shoot.
I want to talk to you about Greg. I'm worried about him. Have you seen much of him lately?
Not really. I've been pretty busy, Dad.
Well, you know, now that he's out of the hospital, things must be a lot rougher for him than he thought they'd be. At the hospital, everything was done for him at exactly the right time, and now he's got to keep on a very rigid schedule, and it can't be easy for him. You understand?
Mm-hmm.
So he needs all the support he can get from the people close to him.
Dad, what do you want from me?
Just be a friend.
TV too loud?
No, it's okay. Kenji called again. I couldn't get back to sleep. Ken, give it a rest, will you?
Dr. Kulani, it's Tony Metzger.
Oh, sorry, Tony. What's up?
Well, I hate to bother you, but you wanted to know Greg Caldwell's lab values from this afternoon?
Yeah.
Oh, there are some abnormal levels I thought you ought to know about.
Okay, Tony, thanks.
Oh, yeah, and I called that boarding school. He wasn't there.
Oh, okay, thanks. Pono, do you have any idea where Greg might be? They called his school, but he's not in his room.
What's wrong?
Well, we've got to find him. He may be in serious trouble. Did he say anything about any plans for tonight?
We stopped by here around 3 o'clock, so he's going on a bike ride.
Uh-oh. Come on.
We always stop up ahead, Dad. Not a lot of cars pass by here. There, up ahead. What's that? That's him. That's Greg.
Greg?
What's wrong with him?
He's in shock.
Keep your hands on him. Just lay him down.
What's happening?
Probable diabetic ketoacidotic coma.
Any chance it's hypoglycemia?
Possible, but doubtful. He's tachycardic and hyperventilating. But I gave him a bolus of glucose in case. I need a stat SMA panel and an arterial stick. Oh, and get me the status of his bicarb. Right.
His pressure's 80 over 60.
Hanks in normal saline. Infuse 1 liter an hour. And I'm going to want an insulin drip. Give an IV bolus of 20 units regular insulin stat. And start the drip at 20 units per hour.
I'm having trouble getting a vein. They've all disappeared.
I'll do a cut down.
How long has he been like this?
I don't know, possibly hours.
Then we better hope it's not hypoglycemia. He could have some brain damage.
We got some lab values. His glucose is sky high, 857. It confirms ketoacidosis. It's not hypoglycemia.
Thank God.
How's his sensorium?
In and out. You saw his pH?
7.2. Severe acidosis. You think we ought to give bicarb? I mean, the risks...
I know. Cardiac arrest because of the potassium shift, but we may have to do it anyway. Monitor his potassium level closely. I want a couple of amps of bicarb ready. I want them ready just in case. If his next set of labs doesn't show improvement, we'll have no choice. Pono. He's pulling out of it. He'll probably be okay.
Dad, I gotta tell you, he wanted me to go with him, and I said no.
It would have happened whether you were around or not.
I know, but the truth is I didn't want to be around. I was too freaked out. I mean, two people I really care about. At my age, and both of them were really sick.
Well, what Elisa had was incurable. Greg's a whole different story.
I know, but I kept thinking about her. And then I saw Greg give himself a shot, and that was just so weird. And I thought, no way, just stay away from it. And that's what I did.
Pono, I think I owe you an apology. You know, I'm around illness so much of the time that I forget how confusing and scary it can be. I should have caught on. I should have given you a chance to talk about it.
You did. But I was too busy suffering to think about what Greg needed. Great friend, huh?
A fallible human being who's thought things out pretty well. Ergo, a good friend.
Sounds like something Greg would say.
I could use some breakfast. How about you?
I think I can handle that.
Oh, yeah. I noticed this last night.
I looked at these signs,
Hi.
You still here?
How you feeling?
Bring on the polka music. I really did a number on myself, huh?
Yeah. Yeah, you did some job.
I'm sorry that I lied about the insulin injections. I don't know. I just thought that if... I don't know.
You thought your diabetes would just go away, huh?
Yeah, I guess. Pretty stupid, huh?
Not stupid, but not too smart either. It's called denial.
I felt like a freak. I didn't inject myself with needles. You know what that's like?
No, I can just imagine.
All I wanted was a chocolate shake. And then that's when it hit me that everything was gonna be different from now on. That when I go on a bike ride, I'm gonna have to think about my sugar and I have to eat when it's time, whether I want to or not. Nothing's gonna be loose anymore, you know? Is it always gonna be this different?
Yep. Unfortunately, it is. You're always going to have to worry about certain things that other people just take for granted.
I don't want to be different. I want to be like everybody else.
That's what everybody thinks they want. But the fact is, we're all different. That's what makes us interesting. Greg, it's going to be a struggle. It's not going to be easy. But I'm here to help you, and you'll adapt. You'll learn how to handle it.
I guess I don't have much of a choice.
You'll always have a choice. But you'll make the right one. I've got faith in you.
Thanks for the vote of confidence.
Boy, you look terrible.
It's been a rough night.
His papers are ready, Doctor.
Good, let's expedite.
What papers?
Kenji, I'm transferring you out of this hospital. Harry Brent's agreed to take over your case.
Ah, no way.
Now, you need a good osteo man, and Harry Brent's the best in the business. To say nothing of the fact that even though you are like a brother to me, if I have to take care of you for 5 more minutes, I may end up strangling you with my bare hands.
Look, I know I've been somewhat uncooperative.
Somewhat? But I didn't come here to argue. Believe me, this is for the best.
What if I promise to behave? Oh, come on, I haven't been that bad.
Let me put it this way. This is not one of those times I will look back on and laugh about. Kenji, for the sake of our friendship, get in the wheelchair.
Well, at least I won't have to eat the food here. Easy. Easy now. Watch it. Look out. Don't bump it. Okay, careful now. Watch my IV pole that isn't tipped. Watch out for that cart. Oh, that's close. A little slower, please. This is a hospital. Watch the doors now. Watch the doors.
It's awfully quiet all of a sudden.
Yeah. Too quiet.
Bite your tongue.
They said it was all right for me to come in.
And pull up a chair, Kulani. I love that coyote.
Yeah, he's cool.
Good old coyote.
You gotta admire his resiliency, though.
Resiliency? Why, Samuel, very articulately said. I do believe you have been perusing your thesaurus.
Greg?
Sam.
Just let me say this. I'm sorry that you have diabetes and that things are going to be different for you now. But mostly, I'm sorry that I wasn't there for you when you needed me. I got a little confused about who had the problem.
It's not uncharacteristic of you, Sam. Not at all.
Right. And another thing, I wish you'd get better because the race is in 2 weeks and the team's a disaster without you.
Well, I'll keep that in mind. Thanks.
Next on Island Side.
Veronica!
Do you know that I really care about you?
We got 1 week before they evict us.
This hunger strike is dangerous for you.
The strike's our only weapon.
Don't let Ray down. Don't let yourselves down. People, stick together on this. You can win.
I didn't appreciate that grandstanding stunt that you pulled today.
Are you threatening me, Mr. Sorrell?
They want you out.
But we're not standing still for it. No way. You want that burn center, Margaret? You tell them to back off.
I don't know what to say.
Ask me to marry you.
This is Kathleen Sullivan.
And I'm Harry Smith. Tomorrow, the Grateful Dead and Isabel Sanford from the Jeffersons.
This week, Florence Henderson, and we'll be at home with Suzanne Summers on CBS This Morning.
Stay tuned for your local news.